So we'll start the panel sessions now. This is a plenary because we are introducing the work that the Women and Media Collective and the Social Scientists Association did over a period of 2.5 to 3 years in 6 districts on unpaid care work in Sri Lanka. Okay. I want to start with this quotation. Remember, we are having simultaneous interpretation. So, care is a critical dimension of well-being. People need care throughout their lives in order to survive. Care has long been considered to be the natural responsibility of women, as a result of which the costs of providing care fall disproportionately on women. These costs include foregone opportunities in education, employment and earnings, political participation and leisure time. It captures very briefly some of the essence of care work. The objective of the Women and Media and SSA research was to compile evidence-based data that recognizes the context of unpaid care work in Sri Lanka and to advocate for effective measures to reduce and redistribute the unpaid care burden of women. We wanted to build on feminist advocacy in Sri Lanka and the realization that women's rights and gender equality through knowledge on social and economic value of unpaid domestic and care work in Sri Lanka, and to have data to calculate the women's economic contributions to their households and to the national economy through valuing unpaid care work. In Women and Media Collective, we, I think in the late 1980s, had already picked up on this area because we produced a series of film slides on the double burden of women. So while the debate, the global debate on unpaid care work was taking place in, on the one hand, in Women and Media, the activism, feminist activism and the focus on women's human rights was unfolding. I think some of the key authors in this area I have just listed here, because in 1999, a New Zealand feminist economist wrote in 1999, counting for nothing what men value and what women are worth. Why we did this work with Women and Media, with SSA, is the persistent argument from policymakers, economic analysts, and most donor or international organizations that women's labor force participation is low in Sri Lanka. The concern is often articulated by bringing in, comparing or pushing out the welfare, the positive welfare programs that have been in operation in Sri Lanka. Universal access to health, which means anybody can walk into a government hospital and be treated. We have access to education, irrespective of whether you're a girl or a boy, and from primary school onwards. So why is it that then women are not in the labor force? There has been little focus on the gender division of labor in households and the expectation of women's responsibility for care in the home, or on assessing the value of this work that is done in the home, or the imperative of redistributing unpaid care work with men in the household, which would likely allow women to take up paid work. We thought this research that we were getting into would fill this gap. And we also felt that if with the findings of the research, the arguments for expanding the definition of what is work can be strengthened. Women work every day, but only when women can show that they directly and regularly earn a monetary income is their labor counted in the national labor force. If not, for the most part, they are seen as and see themselves as just housewives who do nothing at home. And I'd like to invite all of you to ask, when you go on your work and you ask a woman, "Oya monada karanne?" and in Tamil, you know, what are you doing? And most often they say, "Nikang inna," right? We are doing nothing. There is still much confusion among policymakers as well as among researchers and activists in Sri Lanka as to what unpaid care work is and why it should be an issue that should be addressed. One of our first meetings with the group of organizations that were part of this research, there was some confusion or some anxiety that we are trying to bring in focus on the work, on the care, on the love and affection with which women do work in home, and what is the problem. අපි මේවා කරන්නේ අපේ සෙනහස නිසා, ආදරය නිසා. This is another definition I think is very useful. Unpaid care work is unpaid because it arises out of social and contractual obligations such as marriage or formal social relationships. It is care because it is a group of activities that services people in their well-being, and it is work because it is an activity that has costs in terms of time and energy. Bringing unpaid care work, its economic value, and the rights of women within the domestic context into focus also muddies somewhat the waters of most mainstream gender and development thinking that giving women access to income earning opportunities was the priority for gender equality. In this, I think the Sustainable Development Goals stand out. It's the first time that in the global development discourse at the UN level, that the UN specifically asked governments to set targets to recognize unpaid care work and acknowledge the need for shared responsibility within the household and family, and of course it says, as nationally appropriate. One of the aims of the research by WMC was the use of a diary method to assess the time that is spent by the designated primary household member on unpaid care work. And this was informed by the literature on time use surveys. Pradeep will, in the next session, go into more detail on the methodology and the diary. One author called Budlander finds that time use surveys are a good basis for discussing unpaid care work in more concrete terms. How responsibility for this interacts with the performance of other activities, such as earning an income. For example, in Bangladesh, a study by the Center for Policy Dialogue looked at the hours of work expended by women and men in care, computing the economic value of this labor to, quote, estimate the cost of unaccounted work performed by women and connect the findings with mainstream national accounting. I think in Sri Lanka, that is what we are also aiming at. That is what we should be aiming at. Quantify, value, and recognize that this is labor which is contributing to the national economy. Now, the Department of Census and Statistics carried out its first time use study in 2017 and confirmed the extended hours that women engaged in the unpaid care work compared to men. The WMC employed an extended coverage of care activities. It's we try to capture more aspects of women's lives that are linked to a part of unpaid care work, and shows approximate actual hours that are spent by these household members. In the chapter this afternoon, in the presentation this afternoon, Dr. Dilani Gunawardena from the University of Peradeniya Department of Economics will present the results of the time use data of the Women and Media and SSA study. When we understand the meaning of unpaid care work, we are also able to understand the concept of time poverty, where women are unable to take up paid work because of the time and labor already expended in the care of household members. So this was touched on by the keynote speaker, Dr. Deepta Chopra, this morning. Time poverty also impacts on women's health, reduces opportunities for women to engage in activities, or even in activities where they can raise their voices and to say what their needs are and concerns. And one study says women's time poverty must be addressed as a global national moral imperative and a fundamental human right. Now, our research was carried out during the period 2018-2020 in the districts of Colombo, Gampaha, Kurunegala, Badulla, Kandy, and Batticaloa. We worked with 6 organizations from these districts. All of them are represented here in this room today, I'm happy to say, because we've had the organizations have done extensive work in their districts, and Women and Media has engaged with them as well. The organizations are the Women's Resource Center Kurunegala, Women's Development Center Badulla, Damidu Collective Gampaha, Diriya Savikanta Sangvidhanaya Gampaha, Surya Women's Development Center Batticaloa, Working Women's Forum Kandy, and Women and Media Collective. Women and Media Collective was a recipient of the Australian Awards Fellowship in 2017, and it was facilitated by an organization in Melbourne called JERA International. And our theme for that program was My Time, My Work, My Value, Unpaid Care Work in Sri Lanka. And the organizations from the representatives from the 6 organizations that we worked with also formed the team that went to Australia. And I think the exercise sharpened our understanding of government and private sector approaches and support for care facilities for the elderly as well, and an NGO engagement with advocacy for recognizing unpaid care work in Australia. It also touched on the complexities of recognizing and including effective policies and programs for support services for primary carers who are female. Now, a factor that cut across women's lives in Sri Lanka was the time and labor that they allocated, aside from remunerative work, if any, for household activities, and the balancing of their engagement with economic, social, and political activities. On a daily basis, women take care of children, cook, are responsible for the well-being of elders, if any, in the household, ensures that children are dropped or picked up from school, that children have a meal ready when they come home, that clothes are washed, water or firewood is fetched when necessary. Some women work in paddy fields or in home gardening, and many women also attend community-level meetings. But the concept of work that is defined in mainstream economics is limited to labor that has remuneration. So our labor force, the census, defines the age of 15 as economically active. I know we have 2 representatives of the Department of Census with us today, so I'll be very happy if you all can engage in the discussion as well. Persons who are so recognized as contributing to the national economy are included in the labor force. So in 2019, I'm looking at 2019 because it was during the period that our research was taking place. Within a total population of 16.4 million over the age of 18, there were more than 1 million women, more women than men. The labor force participation, however, for women was less than half that for men, 34.5 compared to 73.0. This trend hasn't changed for several decades. In 2006, the women's labor force participation was 39.5 and men 76. And in 2021, it was 31.8 for women and 71 for men. So, and during this time, the 2019 data that I'm looking at, and it really hasn't changed very much, there were 5.7 million who were not in the labor force, compared to 2 million men. How does the census define not in the labor force? Those include, not in the labor force include those who are engaged in studies, engaged in housework, old age, physically ill or disabled, or other. What gets overlooked in this approach to labor are the asymmetrical relations of social, economic, and political power that are embedded in assigned gender roles that effectively mask the labor of those engaged in the care of household members. So, for a woman to be able to take up productive work or look for paid work, she has to ensure that gendered reproductive work, which she's socially and politically responsible for, is managed. If this is not possible, she may not take up direct paid work, and then she's not automatically considered to belong outside the labor force, economically inactive, engaged in housework, despite the labor she puts in on care work in the house, in the home. I think another aspect that, that when we were looking at this research and looking at the findings also, is the concept of family. In the family-based household, these are centered on social structures and relationships of marriage and kinship. The household is viewed as constituting a heteronormative family based on marital relationships with dependents, young or old, whose interactions with the economic and social spheres require interventions to ensure economic development and social and political stability. The definition of the family, I brought in two examples. One is I looked at a couple of policies, and the other I looked at was a political manifesto. Now, I think I should go here first. In 2010, Sri Lanka developed a family policy for Sri Lanka by the Institute for Health Policy. So it states, the family as the basic unit of society performs many functions in the development and well-being of its members. Families share resources, care for their members, including children and elderly, the sick, disabled, and offer a nurturing environment to children in ways that no other institution can provide. The development framework of the then political party in power in 2010 states this: women as a pioneer of development of Sri Lanka. Sri Lankan women has a comparatively better status in terms of literacy, health status, and gender recognition. She holds a prime place in the family and is considered as the pioneer who drives the family towards a disciplined society. The contribution of women to the economy of the country is also highly significant. The election manifesto in 2010 of one political party states, a prosperous family, under the theme the very existence of the world depends on the affection and love of the mother. It is through this affection and love that children acquire a healthy mind and a balanced personality. It is my belief that whatever may be achievements, our focus be on the family consisting of mother, father, and the children. Pride of place to the mother. Women make a major contribution to the economy of our country. The contribution of women in the plantation sector, in foreign employment, and the apparel sector has increased significantly over the years. In such a context, I believe that the women in our country should not be afforded equal status, but rather be given higher priority. So, I think questions that emerge: how do roles and responsibilities of families and households interact with other activities such as earning an income? How do social and public policies conceptualize care within the family-based household? How do social policies that target households through poverty alleviation programs, elder care benefits, disability care benefits, envisage the distribution of care responsibilities within the household? Do these policies ensure that adequate funding for quality care services are made available and accessible for the beneficiary? Is there an acknowledgement or general recognition that such policies ensure adequate allocations to funds that are made to reduce the burden of care by the primary care holder? Are these policies designed for carers, recognizing the time and effort expended by such persons in the household? Now, the way in which policy and rhetoric, and very often the political rhetoric of a party that wins, becomes integrated into the framing of policies, particularly as this one I quoted, It says it's not equality, but high priority. That's what we want for women. The family is presented as a harmonious unit where the responsibility for the well-being and welfare and well-being of its members rests with women. Words such as nurture, affection, love of the mother are recurrent and powerful images. There is no tangible role envisaged for the father of the family. Women contribute to the economy through employment, but the declarations that I cited are silent on the value of the unpaid care work performed by women. Mothers and motherhood become the key factor in the socio-economic and political framework for welfare development and for public and social policy. So we plan to consolidate the findings of this research, which the findings Pradeep will speak about briefly, and then we will also have some highlights from our in-depth discussions in the next after Pradeep. We plan to consolidate these findings into a series of awareness-raising programs on unpaid care work with the organizations that were part of this research in their respective districts. The organizations who are here now, they work with women in agriculture, returning migrant workers, women employed in the free trade zones, women from the plantation sector, women survivors of conflict, women in urban low-income households. So basically, the organizations that are working on this with us actually cover a whole vast canvas of women in our society. And with that, with all those categories where women are in paid employment, there are also women who are not in paid employment and are engaged in unpaid care work. Those who are engaged in paid work also, it doesn't, as Dr. Chopra pointed out, whether you are in paid work or not, you still are expected to fulfill your unpaid care work. Yes. Given the current economic crisis the country is facing, there are already moves to curtail budgetary allocations for public and social programming. These decisions are going to impact on households' access to services, as well as intensify the financial constraints that households are facing. This economic crisis adds to the urgency of the 3 Rs: recognize, reduce, redistribute of unpaid care work, as the burden of unpaid care is increasing within families, and women are being pushed to maintain the well-being of households, irrespective of the sharp rise in the cost of living and the depletion of state funding in the social sector. So, thank you very much.